Good afternoon and welcome to the Columbus Metropolitan Club. I'm Steve Marks, Chair of the CMC Board of Trustees and President of the Hannah News Service here in Ohio. Let's thank you to today's forum sponsor, the Crane Group. Thank you. And from today's forum partner, WBNS 10 TV. Today's CMC live streaming is presented by the Emergency Response Fund of the Columbus Foundation in partnership with the Columbus Dispatch and PNC. Thank you all. We'd also like to thank those of you who purchased a virtual seat for today's forum. We are very grateful for your continued support. You can learn more about CMC, register for events, join or renew your membership, purchase a virtual seat, or make a donation anytime at columbusmetroclub.org. CelebrateOne emerged in November of 2014 as the city's initiative to lower infant mortality rates. CelebrateOne educates new parents about the importance of safe sleep for infants, connects women with affordable health care options, provides opportunities for mothers to interact with trained child care professionals for free, among many other key initiatives. What type of progress has been made on the ambitious goal to reduce Columbus's infant mortality rate, and how did CelebrateOne carry out its mission during the challenges of COVID? Today, Columbus Mayor Andrew J. Ginther and our panel of experts will discuss how they are addressing the critical issue of ensuring healthy babies, more importantly, at-risk Black babies, survive, thrive in our community. You can find out more about today's panelists in your forum flyer and online. And now please welcome Erica Crawley, Franklin County Commissioner. Christine Sander, Director of Infant Wellness Initiatives at Nationwide Children's Hospital and the Ohio Better Birth Outcomes Collaborative. Maureen Stapleton, Executive Director, CelebrateOne, City of Columbus. Our host, who you will see a little later, Tracy Townsend, WBNS 10 TV 8 News anchor. Before we hear from our distinguished panel, it's CMC's great honor to invite Columbus Mayor Andrew J. Ginther to the podium to share his perspective on CelebrateOne. Mayor Ginther, the podium is yours.
Had to make sure I had my branding right for today's opportunity. It's great to be with you all today. Really excited to hear. I think it was important that Steve said, Mayor Andrew Ginther and the group of experts, because you're going to hear from the experts about this incredible work, this movement that we've started in Central Ohio to put better birth outcomes for children, particularly for Black moms and for Black babies, as a top priority for this community. It's part of our city's equity agenda. It's part of the county's work of Rise Together and the Poverty Blueprint. And so excited to have both the city, the county, and our leadership teams here today. Really excited. I was just telling Tanny about this. So excited to have our newest county commissioner, Erica Crawley, joining us and leading this work. Amongst her colleagues, she was one of the deans of maternal health and reducing infant mortality, particularly through that lens of equity in the state legislature, and has a great bipartisan track record, and look forward to her service as one of our newest county commissioners. So excited to be with you. It's great to be back here at the Metropolitan Club. As Steve mentioned, back in 2014, with a group of dedicated partners, we launched the CelebrateOne initiative, prioritizing those neighborhoods where infant mortality rates are the highest and where we can have the greatest impact on saving young lives. And with the hard work and dedication of our incredible CelebrateOne team and countless partners and volunteers from across the community, the infant mortality rate in Franklin County has declined from 8.4 infant deaths per 1,000 live births in 2014 to 6.7 deaths in 2020, a 20% decrease in infant mortality in this county. All of us deserve credit for that. But we're just getting started, because we know the racial disparities remain glaring. And part of our discussion today in the reboot of CelebrateOne 2.0 is how do we really delve and focus on the racial disparity in particular. Although we've seen a 20% decrease overall, a 24% decrease in infant mortality amongst African Americans, we know that that disparity is still up about 3 to 1. So black children are 3 times more likely than white children to die before their first birthday, still in this county with all this great progress. So it's a way for us to come together to celebrate some of the success, but also demand a call to action and move forward with a sense of urgency, because we literally are fighting for every child, and particularly our black children in this community, and that's what today's Metropolitan Club is all about. 2 weeks ago, with our community partners on hand, we announced the CelebrateOne strategic plan for the next 5 years. To start, we're expanding our efforts to improve the health of women before they become pregnant, as well as decreasing the number of premature births. And we're analyzing these issues from multiple angles, including housing and programming, resources and intervention, and new opportunities for support during pregnancy, after pregnancy, and beyond. We must continue to address the social determinants of health through an equity lens. Our goal is to make sure babies not only reach their first birthday, but thrive in their earliest years of life and are kindergarten ready in our schools. Our mission is urgent. Our focus is clear. Our children deserve all we can bring to support them in these formative years and beyond. I really want to thank both former Governor Kasich and current Governor DeWine for all of their support of CelebrateOne. Erica and her colleagues, the County Commission, former Commissioner Marilyn Brown, Commissioners O'Grady and Boyce have all been major funders and supporters, as well as many of the health systems, our corporate partners. We wouldn't be here today without the community's engagement, involvement. We built a movement, and we're just getting started. It's my pleasure to introduce our moderator for today's discussion from WBNS Channel 10 TV. Please welcome Tracy Townsend.
Good afternoon. No disrespect, I just have to do that. Well, I am really excited to be here and to be in person and to see all of your faces. It's always exciting to get an invitation to join you here for the Columbus Metropolitan Club, and of course today is no exception. This afternoon, we do have a call to action, reducing infant mortality and closing the health equity gap. This subject matter promises to have all of us thinking and talking about how we can make our community an even better place to call home. Social determinants of health, closing the racial gap, racial equity. The pandemic put these phrases, these issues front and center. Little inside baseball, they put them front and center in a newsroom where we hardly ever use those words, those phrases, until the start of the pandemic. And I think that's a really good thing because it started the conversation in a newsroom. It started it in people's homes. And I think it made the community start to think about those things. And I think that's where we start taking action as a community, because these are not courses of action that we need to be taking in a silo. And so today we're going to push them even further with the goal of looking ahead, of course, to the next 5 years. So we do want to start with a congratulations to CelebrateOne for the progress, and of course its executive director, Maureen Stapleton. And I want to just be fully transparent here. Maureen and I have known each other, I think we met before the pandemic really started, but via Zoom. So today we got to meet in person. That was exciting. But we've talked almost once a month. And so that's where I sort of want to start our conversation and have you do sort of a level set and talk about the challenges, the ups and downs of dealing with reducing infant mortality in a pandemic, in a new city, because you moved here.
Yeah. Well, thank you very much, Tracy. I think it's important to level set. The mayor has told you about the progress that we have made as a city overall in infant mortality. But we do not do this work alone. CelebrateOne is a backbone agency. We rely heavily on partners and lead entities and a staff to move the measures forward that we know are going to have the greatest impact on infant mortality. And again, we've had some success. I think the challenge is pretty clear, and the call to action for us is pretty clear. How in this next 5 years can we end the disparities that we see, unfortunately, getting worse, not better? And so, level setting, infant mortality in the city, down. Disparities between black and white babies, larger than we've ever seen it before. And so that's the call to action. And the way we do that, Tracy, is with many, many, many people in this room. I'm going to take a liberty and do two things. First, will the CelebrateOne teams please stand up? These are health workers, these are administrators, these are folks who work every day leaning in for our babies and their moms. I want you to continue to keep standing because I want you to understand the power of partnership. Will everyone who works with CelebrateOne in this room right now, will you please stand? That's how we get it done. And that's how we will continue to get it done in these next 5 years. Focusing on, thank you everybody, focusing on racial disparities, but not changing the goals of CelebrateOne. We have always been the backbone. We have always wanted young people or babies to get to the age of 1 and beyond, and we've always used two outcomes: lowering infant mortality and lessening the disparity. And the only thing that we're going to do different this time in terms of the goals is switch them. And we're going to start talking about lessening the disparities and doing equitable work in our CelebrateOne communities so that we can see that infant mortality of black babies meet the same level as white babies. But how do we do it, Tracy? And how will we continue to do it? Through collective action, through accelerating our progress in African American communities, from holding ourselves and our partners accountable. We meet monthly to go over numbers and programs and see how things are going, and to continue to do that in order to make the impact. The other thing that is important to note is that we also need to be innovative. Many of the things that we have done are working. But we're going to rely on the community, especially the philanthropic community, to allow us to take some chances, to do some things a little cutting edge and differently that may not have all the proof behind them, but we see an opportunity to impact upstream or impact the outcomes. And so we'll be talking to the community about how we engage with that. We have a team of professionals that on the nonprofit side of our organization that help us send that message. They're here today, Millard Consulting. But I just really want you to understand that because of the people in this room, we have made impact and we will continue to do so.
We are going to be casual. We're going to have a real conversation here. Christine Sander is here from the Ohio Better Birth Outcomes Collaborative, where the work is on increasing access to prenatal care and reproductive health services. But really the other side of that work is continuing education for providers and for staff. And I was really struck by the fact that you also work on addressing racial bias and providing evidence-based counseling to improve health before pregnancy. And for some people in other social economic groups, that's what you do. I mean, that's what I did. I got my prenatal vitamins before I had my baby. I knew take my little jogger and go work to be healthy, not gain too much weight. I know. I had my baby years ago. I know it doesn't look like it, but anyway, I digress. But tell us more about those issues and another buzzword, buzz phrase, but very important to the conversation: cultural competencies, those kinds of things, because we did have to kind of peel the bandage off and talk about some things we didn't really talk about publicly.
So to give a little bit of level set and definition to the mouthful of Ohio Better Birth Outcomes Collaborative, which I'll heretofore call OBO for ease of getting it out of my mouth. So just a little bit of background. OBO is actually how the hospital systems in our community align around this infant mortality work. So our partners at Ohio State, at Mount Carmel, at Ohio Health, OBO is actually funded by those systems as well as Nationwide Children's Hospital to align on this work. We also work very closely and have great representation from our federally qualified health systems in the community, PrimaryOne, Lower Lights, and Heart of Ohio, as well as Columbus Public Health. So we all work together to align on interventions, activities, measurements that speak to some of the areas that Tracy was just mentioning. So in our first phase of work, what we really addressed was that access and that entry to prenatal care. So working with partners like Physicians Care Connection, we worked to get women into prenatal care as early as possible, regardless of their insurance status, regardless of where they lived in the community, regardless of what language they spoke, et cetera. We also worked to expand capacity to programs that we know, when coupled with prenatal care, improve birth outcomes. And not just improve birth outcomes, but improve the disparity that exists. We talk a lot about prematurity prevention because that is one of the leading preventable causes of infant mortality. So you'll hear the healthcare communities talk about prematurity, reducing prematurity, and what we're talking about is babies that are born less than 32 weeks gestational age, so this very early premature babies. So we will work very hard to connect women to programs like Nurse Family Partnership, Healthy Families America, home visiting things, as well as other perinatal supports like legal services, legal representation through a partnership with Legal Aid Society of Columbus. We will work to connect women and family members to tobacco cessation services through a partnership with Columbus Public Health. So largely focused on access and getting women the care and the supports in addition to that care that they need. As we move forward to this next phase of work and kind of shift to thinking about that racial equity a little bit in a little bit more of a focused way, we will be adding a couple of areas or bodies of work to our mix. Certainly we want to accelerate and not lose sight of that access and what we've built and what's contributed to the success that we've seen, but we know we need to do, as Maureen said, much more and much more focused. So one of the interventions that we will be getting off the ground here in early 2022 is ongoing education, continuing provider education around racial bias, explicit and implicit, the history of reproductive health justice, the stigma and the discrimination that women of color often experience when they interact with the healthcare system. So over and above what each entity is already doing to address those things within their own organization, this will take a specific focus on how that plays out in women's health. And not just include the health systems and the federally qualified health centers, but even reaching out and working with the private practices, physicians, nurses, frontline staff who are working in and around women's health every day. We will also move further upstream and engage with our primary care community to look at women's health pre-pregnancy. And so that's something that Tracy mentioned we've already started, but we will take a more intense focus on and look at preconception health, especially in populations that have been known to be associated with higher risk. So looking at women with diabetes, women with hypertension, women who have health issues that have been linked to premature birth. We will also connect and increase access to women's health services to reduce the unintended pregnancy rate in our community. And finally, we will be taking a much more strategic approach to how we connect women to perinatal services over and above prenatal care based on where they are as a family. So there are certainly services, like I mentioned, with home visiting, where it's primarily Medicaid eligible women can connect in and receive that support. There are also services such as doulas, community health workers, group models such as Moms2Be or Centering Pregnancy, that depending on where a woman is in her journey or a family is in their journey, can increase the chances of having a healthy baby and a healthy delivery.
Those community health workers can really be so tremendously important and valuable, that relationship. Let's say congratulations to you, Commissioner Crawley. And I love that the mayor called you the dean. That's going to stick with me for now. So, of course, you have traveled the state, and this has been your mission. Now you're here in the county, and so we're all ears. This is a personal mission for you, so can you start there?
Absolutely. Thank you. So it is a personal mission for me. If you've not heard my story, I was pregnant at the age of 22, had my twins at 23, and I had a very traumatic pregnancy. Went into preterm labor at 18 weeks. I was in a car accident. Thought I was fine. Over the weekend, I thought I was experiencing Braxton Hicks contractions, but as time went on, over the weekend, my contractions got a little bit more intense. Decided to go to the hospital, drove myself to the hospital on a Monday morning, and found out that I was in preterm labor, and I had to go right into surgery to put a cerclage in. And then that really just set a trajectory for a lot of different complications during my pregnancy and after. I was on bed rest in the hospital for 16 weeks, became severely anemic. I was in Georgia at the time, had moved to Georgia to get take on a new position, so I had no family there, by myself, and but always had God with me. And ended up having to get betamethasone to mature the baby's lungs, because even though I had a cerclage and was on bed rest, continued to contract that whole time. Around 32 weeks, or 34 weeks, 32 weeks I got the betamethasone, 34 weeks they decided to go ahead and remove the cerclage. That was a Wednesday morning at 10 o'clock in the morning. They said, well, you've been contracting, you'll probably go into labor on your own over the weekend. We think around Sunday or Monday, you probably go into labor. Again, got my cerclage taken out at 10 o'clock in the morning. At 2 o'clock that afternoon, they said, we need to take these babies. So I went into emergency C-section. Stayed in the hospital about 5 days, went home and started experiencing some severe pain in my abdomen. Ended up going to the emergency room. Me and my mom, she drove me to the emergency room. I did not have my twins at the time, was pumping and breastfeeding because they were on a special formula. Didn't have them, so new mom, nervous, scared, not sure what's going on, and really just sat in the emergency room for several hours. My mother and I was like, okay, what's going on? Are you gonna run some tests? And finally, after several hours, they were like, here, drink this barium. You might have a bowel obstruction. We'll do some tests later. It was very nonchalant, and like no one really was taking my pain seriously or what I was even going through as a new mom, several days out from just having an emergency C-section and an excruciating pain. All of that for them to just say, oh, you have a pocket of blood collecting in your pelvis. Go home, take something over the counter, you'll be fine. That was 17 years ago. And when I decided to run for office, one of the things that I decided to do, I wanted to really focus on maternal health because of my story, but I had been hearing the same stories, and I still do till this day, 17 years later. That was my experience, and I continue to hear how we go into a healthcare system that does not value what we are saying we are experiencing. We're not taken seriously, we're dismissed, and if we think about the leading causes for maternal death, it is usually hemorrhage or hypertension, but that's how things happen. People are dismissed. And so I said, I don't want to hear another story like that, and I was going to do everything that I could to make sure that not another woman dies from a preventable death, but also that we can impact infant mortality by impacting maternal health. And so that has been my mission.
Okay, and then what? I mean, wow. Wow.
I get very emotional because,
Understandable.
I mean, as I traveled the state, in the legislature, and even talking to people now in my current role, and I talk at the federal level and the local level and everything in between, and just with communities. This is something that we really can make a difference in, and it's sad that we have not been able to impact infant mortality in a substantive and meaningful way, especially when it comes to the disparities. And so I'm looking forward to the conversation, but yes, this is something that is near and dear to my heart, and I am very emotional about it because I know we can make change.
All right, so I'm going to let you collect
Yes.
yourself just for a minute. We'll be back. But I do think, Maureen, that this speaks to, Director Stapleton, this does speak to the fact that this is not necessarily just a Black problem, and it also speaks to the fact that it's not really a socio-economic issue. So can you pick up from there?
Absolutely. Infant mortality is not identified by race or economics and social economic standing. What do I mean by that? You can be a college-trained, master-degreed African-American woman and have the same birth outcomes as someone who's not African-American who has a high school diploma. 1/3 of the women who experience infant mortality, about 1/3 in Franklin County, are not connected to our social service or our social service medical system, meaning they don't have Medicaid and they're not Medicaid eligible. So this is not about how much money you have for many folks, and it's not about any of the normal impacts that we would put in our minds as a reality. So what else is it? It is listening to a mom when she says she's having pain. It is dismissal from doctors who need a little more assistance and support in understanding how to communicate. They've got the medical training, they understand what they're doing, but they need some additional training. What we're lucky, and I tell the mayor and I tell everybody all the time, having worked around the Midwest, Columbus is lucky to have such a collaborative spirit and way about the way we do this work. When Christine says she represents OBO, that's all the birthing hospitals, that's all the federally qualified health centers, all making the commitment to do implicit bias training, doing the extra work for our medical professionals so that we don't have those kinds of disparities and we don't see the folks that we, in our minds, traditionally don't think are having a problem, but actually are having the same problem. There are other things other than the social determinants of health. Now, do the social determinants of health impact many of our moms and their outcomes? Absolutely. But when you talk about a college-trained, upper middle class, multi-degreed African-American woman having the same birth outcomes as someone who doesn't have all of that benefit, there's a problem. And we know it's a problem, and our hospital systems, their executives and their medical directors are leaning in here to develop programs and opportunities to change that trajectory for us.
So, Christine, when you hear a story like Commissioner Crawley's, and you're working with these medical experts, these medical professionals, what goes through your mind?
Right, so thank you for sharing your story. That's very difficult to do and often emotional, I am sure. We had, through the strategic planning process, we have had the opportunity to hear some stories from women with lived experience of a suboptimal birth outcome, and it was not uncommon to hear the interaction with the healthcare system and that affecting their overall experience. And so one of the things that we are committed to continuing to do is to use that qualitative information, those stories, to help inform where we go next. The other piece that we've been able to tap into is quantitative data to understand some of the trends that Maureen just shared. While those are national statistics, when we look in our own community, we see the same thing. So we see this when we look at the non-Hispanic Black population of women who are giving birth prematurely. Black women with an advanced degree have a higher percentage of delivering prematurely than their white counterparts with less than a high school graduation. And in fact, when you look at just the non-Hispanic Black population, you see that prematurity rate increase as the education level increases. So to Maureen's point, we absolutely need to continue the work that we're doing on the social determinants of health side and linking women with prenatal care and access and all of those important things. We also need to be very laser focused in this racial disparity over and above the socioeconomic status. And so to that end, the hospital systems have increased both their financial support and their manpower, which is almost more important, to really looking in and leaning into what can we do differently, to committing time to not just develop the strategies, but actually implement the strategies in these types of trainings. Again, over and above what's happening in their individual systems, but looking at this through the lens of maternal and child health and maternal and infant outcomes.
Is it also a matter of diversifying who's teaching the medical professionals, who we're recruiting to come be medical professionals?
Absolutely, that certainly plays a part in it. You want to, is research that shows when you are treated by somebody who looks like you, your outcome is better. So that is also something that each individual hospital system and health center has efforts around, and we will start looking at that data as a community and kind of pulling that together to understand where we are today and how those efforts are changing that makeup going forward.
Director Stapleton.
One of our partners has just begun a program to work with elementary school and high school young folks to get them into the STEM fields. Those can be our next doctors. So congratulations to Physician Care Connection that has made the commitment to understanding the way we impact cultural competency in our medical professions is to ensure that African Americans and people of other cultures are a part of the stable of folks who are moving up and becoming doctors and nurses and phlebotomists, and even receptionists, who are often the first folks who a mom has to interact with.
Can you talk about, I was just doing a preview of the 5-year program, and it mentions the lived experiences of women. Can you kind of expound on that, what that means?
Yes. The one way you can fail is to plan around a community. And so we are clear that in order to develop programs and opportunities to impact infant mortality, we have to talk to people in the community and engage with people from our community who have been impacted by troubled births and/or infant mortality. And so as we have gone about our plan, both OBO and CelebrateOne included women with lived experience in our strategic planning process, so that we heard that voice and understood the frustrations and the opportunities to impact our work. We also have done 7 focus groups around the city with women who have had experiences. You cannot plan around a community. And so we have used women with lived experience. That's what that means, having been through something. People like the commissioner who have had an experience so that we can impact the work and make better birth outcomes for our community.
And when we talk about, okay, the lived experience and zip codes, Commissioner, I want to come back to you and have you talk about, if you can, what you're working on to address some of those social determinants, housing, jobs, education, because we know that that plays into all of this.
Absolutely. So one of the things that has gotten a lot of traction in the legislature and continues to get a lot of attention is House Bill 142, which is Medicaid reimbursement for doulas. We know that in the state, Medicaid pays for more than 50% of the births, but we know typically those who can afford a doula are those who are not on Medicaid. And so we know that there's been studies that show, there was a study that included Ohio, in part of the Midwest region, that women or birthing people who had access to doulas through Medicaid, they had better birth outcomes. And so that is something that I championed in the last General Assembly, the 133rd General Assembly, and the 134th, all the way up until I left in July. That legislation will continue to move forward. I sponsored that with Representative Brinkman out of Cincinnati. He is committed to moving it forward. I've also continued to have conversations with Director Corcoran, the Director of Medicaid, on that legislation. And Senator Tavares is here, and she worked on Senate Bill 332 several years ago, I think 2016, and the Department of Medicaid, as well as the Ohio Department of Health, is still implementing. Unfortunately, it shouldn't take 5 years, 6 years to implement Senate Bill 332, but nevertheless, that's where we are. The components of that, and one of the things that happened with that was a focus group where birthing people were like, we want access to doulas and some other things. And so I know that the director of Medicaid is looking for House Bill 142 to pass so they can incorporate that in the mom and baby bundle. The other thing that I think is important, I've had that conversation already as I've been at the county working with our health partners, our health systems, is Save Our Mothers Act, which is where Ohio is not an AIM state, and I know that some will say that we are because we have decided to adopt some patient safety bundles, but we have not implemented them yet. And I think that we should be implementing hypertension and severe hypertension and hemorrhage bundles, because in the states that are AIM states or hospital systems that have adopted patient safety bundles have decreased their infant mortality rate and maternal mortality rate, some by 50%. And so we know that that works. And Ohio has received 2 grants from HRSA and the CDC to implement these bundles, but it is taking some time for the state to do so. So you don't need the state to do it. Our hospital partners can do it. They can opt in on their own, and I think they should. The county continues to invest and be a partner with CelebrateOne. Financially, we will continue that investment, as well as we have investments in the Center for Healthy Families, working with our youth who become pregnant and, moving through that life circumstance. And so we'll continue to do that. But when it comes to housing, one of the things that I worked on at the state as I was the ranking member on finance is making sure that we had more investments in our housing trust, or if we could have gotten more funding for programs like Healthy Beginnings at Home, where we were, there was a pilot program helping pregnant women, providing them with housing, some other wraparound services. In that pilot program, they were able to, and I know Maureen can speak to it, that was able to see a decrease in infant mortality rate. So we know that if we remove some of those structural barriers with housing or transportation, food insecurity, that has a direct impact. And so I want to continue to see those investments. I'm looking forward to my role in this space in making sure that we have directed funding in programs that work. And when we look at, or we talk about equity, understanding that everyone is not starting at the same place, making sure that we have targeted investments, and also being open to having partnerships. We like to say evidence-based, but like, how do we evaluate that? And sometimes I got mad at the state, like we say evidence-based, or we throw that word around to exclude organizations who are doing the work in the community and having a real impact and having the outcomes that we want to see. So we need to get past the traditional sense of evidence-based. Of course, we know that something won't work until you try it and evaluate the outcomes, but looking at a non-traditional sense of how we are connecting with our community partners and where we're targeting investments. So that's what, those are conversations I'm having at the county, but continuing to work and partner at the state, because I do need my former colleagues to be on board and to keep that work going.
And since in one of the other hats I wear as I anchor this political show at Channel 10, and you do the state, and well, the mayor did mention Kasich and DeWine, let's talk about how this is not just a Franklin County Republican Democrat issue, how everybody, we all, this isn't just an us or them. And I'm going to put this out to the 3 of you. And then we'll take questions from our in-person and our live stream audience. Anybody want to take that? Why is this something that we should all care about, even if we don't live in Franklin County?
So I like to say that, you want to go on first? Okay. I'd like to say all the time, there's an old adage, a society is judged by how it handles its most vulnerable folks. If we can't, as a community, wrap our arms around babies and ensure that they have the best trajectory possible for getting to the age of 1 and beyond, you got to question what we're really focusing on. The most vulnerable folks in our society are our young folk. And again, I think the collaboration here gives us a really unique opportunity. This is a national problem. This is not a Ohio problem. This is not a Franklin County problem. This is not a Columbus problem. This is the disparities we see in Black and brown babies compared to their counterparts is a national problem. But we really have a really interesting opportunity because of the collaborative spirit here to be the first city in the nation that does away with these disparities once and for all. And so, recognizing that there is no economic boundary that spares you from it, no racial boundary that spares you from it, is the first step in understanding that this is a national problem that we have to address together.
I would just add that when you look at the state of Ohio, we typically lead the country in the worst infant mortality rates. We have been 49th in the country. We are still in the 40s. We have not improved over the last 10 years in leading with the worst infant mortality rates, especially among Black babies. And if you looked at last year's infant mortality report that came out, the disparity obviously increased. We all know that, but to 14.3 deaths for every 1,000 live births for Black babies, and for white babies is somewhere around like 5.5. And if you look at Healthy People 2030 goals, we want our infant mortality rate to be around 5. Well, we're almost there for white babies, and that is great. We want to continue to decrease the infant mortality rate for white babies, but we also want to make sure that we get our Black babies down there as well. And so it, again, goes back to health equity and targeted investments. And when I talk about health equity, I'm talking about health equity in all policies. It was a policy that I worked on that I was able to pick up after Senator Tavares left the legislature. And what I said to my colleagues is all of our communities are inextricably linked, no matter if you want to acknowledge it or not. What happens in my community, and I represented the 26th House District, which is East and Southeast Columbus, and the infant mortality rates in that district alone is probably the highest out of all of those in the city of Columbus. What happens in the 26th House District impacts that down in Cincinnati, or that in Gallipolis. And so it will take all of us. It is not Black and white. It's Republican, Democrat. It is all of us. It is all of our families. And that's how I was able to get bipartisan buy-in from my colleague, Representative Brinkman, who asked me to join on my legislation because after championing it the last General Assembly and him coming to me and saying, you know what, after you introduced that legislation, I had a chance to talk to my daughter-in-law and my son. They had a doula. And they talked about how much it made a difference for them. And I feel like everyone should have access to doulas because of what my son went through, and how it will be savings to the state. It is cost savings to the state. It really is. When we put our target on our investments, we do have a return on investment that far exceeds what we put in. And so I think just having those conversations about how we all are impacted. It could be your sister, your brother who might lose a baby because of what happened to his wife or something like that. But it takes having these conversations and understanding that it will take all of us to make a difference.
And that's why they call you the dean. It is the CMC tradition to take audience questions. Jane Scott of CMC is curating those questions from the live stream audience. And for the in-house questions, please keep them brief and to the point. Jane?
Wonderful, thank you. And I'll ask questions online, and then anyone who wants to ask a question, just come on up and we'll do everyone. So this is from Eric Brown. What has been and what should be the role of men in addressing these important issues?
Fatherhood is an absolute must, and we must also focus in on it. And so as we talk about moms, thank you, Eric, for that question. Because when we talk about moms, we really are saying we're talking about families, right? We have fatherhood programs that are funded by the state and local. We have collaboratives where we are bringing in fathers. One of our major partners, Moms to Be, has a Dads to Be class. And they bring in fathers who are new, teaching them the things that people don't necessarily just grow up knowing about raising a child. Fatherhood is an absolute critical portion of it, and it is a part of the work that we do.
Charlita Tavares, and I have a question regarding cultural competence and whether or not we should require it for all health and human services or touching professions.
So I can just add, coming from the state and off of the budget, and knowing that Ohio's hospitals are not licensed and we're moving into a space where we're licensing hospitals, one of the things that we were trying to get in the budget was making sure that for any licensed hospital that it would be a requirement for cultural competency training, but we just wanted to be real explicit and also say anti-racism training. We're just going to call a thing. However, that did not make its way into the budget as some other policy ideas did. But that is, I think that it should be required. House Bill for 11 last year, which was Save Our Mothers Act, would require for every doctor, hospital staff that was coming in contact with a birthing person, be required to do cultural competency training, implicit bias, anti-racism training as a part of their ongoing education training. So not anything in addition to, but what they would already normally have to do to keep their license.
And I would just add that, similar to the conversation we had around AIM states, in the meantime, we don't want to use the lack of a mandate or that requirement as a reason to not proceed. So that is the spirit of our efforts around moving forward with all of the health systems coming together over and above, excuse me, what they do internally for their cultural competency and racial bias training.
AIM stands for the Alliance for Innovation on Maternal Health, and so we use acronyms a lot, but that's what AIM stands for.
So you've talked a lot about the fact that it's a national issue. I'm assuming that there are national coalitions as well. Is AIM a national coalition? And I guess, what are communities learning from each other?
So AIM is national, and they are in partnership with OCOG. And so any state or health hospital system could adopt all of the patient safety bundles. They have primary ones, and then they have some additional ones that you could also add. And they have patient safety bundles on cultural competency, anti-racism. They have patient safety bundles on how to identify behavioral health challenges. I mean, maternal or perinatal mental health is a real thing, and we should be talking about that too when we talk about infant mortality and maternal mortality. And so that's why I said we don't have to have a mandate. Hospitals can take that on, but working with the association, so the Ohio Hospital Association, who I know is working with the Ohio Association or the chapter for OCOG, or ACOG, I'm sorry, and and they're a national group too. So it's partnerships on the state level as well as the federal level.
We also have partnerships at this through the Ohio Collaborative to Prevent Infant Mortality, where folks from around the state get together on a regular basis to share data and information. I'm in constant contact with what I call the other big C's. We have Cleveland and Cincinnati, along with Columbus, that are kind of the largest cities, and so we work collaboratively and share information and data on what we're doing so that we can pick the best of the best and what's working and kind of replicate it. And then we really rely on HRSA a lot. They do a lot of great trainings on infant mortality. I know many of our team tune in once a month to hear the latest trends and opportunities to do things differently. And so I think there's a lot of collaboration, and we continue to work with our hospital folks. It was interesting to note that CelebrateOne and OBO were going through strategic planning at the same time. And we purposely did that to make sure that what our hospitals were doing was going to align with the work of the city and what we were trying to accomplish. So we collaborate at every level and learn from every level.
In other parts of the state?
Yes, absolutely. Cincinnati and Cleveland and Columbus get together once a month, the executive directors, to talk, and then OCPIM is a real opportunity for us to share state data and then what everyone else is doing around the state and in particular regions.
And I think
one thing that if you're not already familiar with, I would encourage everyone to look at is the federal legislation, the Momnibus. I've worked and partnered with Congresswoman Lauren Underwood and Alma Adams. They started the Black Maternal Health Caucus at the federal level. We then introduced a Black Maternal Health Caucus here at the state. But they have legislation that, really spans a wide, from college access for students who are interested in medical school, all the way to impacting birth outcomes. And they have partnerships in the state and in every state across the country.
And I think the only thing I'd add to all of that great collaboration is that our state agencies, both Ohio Department of Health and Ohio Department of Medicaid, whether it's from a policy perspective or, again, just the convening of those statewide experts, that is also an area, in addition to the federal legislation, that we connect closely and often with across the board.
I'd like to give an example. Cleveland, first year Cleveland, developed a movie, a 26-minute movie. It's the day in the life of an African-American professional woman who's pregnant. And it takes you through her day and through microaggressions, through opportunities for doctors to have additional training and to communicate well, through whatever, and then it shows you the outcome of all of those things that happened to this woman who is white picket fence, 2.5 children, dog we don't see in the movie, but we know he's there somewhere, and child in private school. All the things that you would think that would come with a better outcome. Cleveland has shared that statewide, and we are now showing it here in Columbus so that you can be educated and our community can be educated about what those impacts look like. So that's an example of collaboration. They paid for it, they produced, and it is well done, well done. But then they share it with the state so that we can take the message out about how racism and microaggressions and other things can impact birth outcomes.
You have a question?
Hi, I'm Lainey Cuthbert from Columbus Metropolitan Club, and I am proud to say in my home, we're going to have a baby turn 1 September the 4th, a grandbaby, yay. So I was just going to throw that out. But could you expound a little bit on postpartum depression? Because I do feel that that is something that when we're talking about not being recognized and not acknowledged and not given the credence it needs, could you talk a little bit about how you address that?
And speak from the healthcare system perspective, I think that's an example of one of those community supports or those needs that we need to make sure are systematically connected with women. So I think there are several community agencies. I know there are screening efforts that happen at pediatricians' offices and at postpartum appointments and at labor and delivery, but really digging into and understanding the opportunities that exist to make that a standard and make that consistent across race, across socioeconomic, and kind of that systematic connection to resources to avoid that impact.
We thank you for your questions. And Steve's going to come back up.
Oh, excuse me. I hope you found today's forum interesting, thought-provoking. I mean, it's clear we still have work to do, but it is reassuring that we have people, dedicated leaders like this, that are pushing this issue and trying to eliminate another disparity in our community. So. Please make plans to join us next Wednesday as CMC presents CMC at 45. It's our annual meeting, Remembering the Past and Embracing the Future, with very special guests, CMC founding members Sally Bloomfield and Mary Lazarus. Our thanks to today's forum sponsor, again, the Crane Group, for their support for today's forum, and for WBNS 10 TV and to the Emergency Response Fund of the Columbus Foundation for presenting our live stream in partnership with the Columbus Dispatch and PNC, and to thank our online virtual seat patrons as well. Our special appreciation and thanks to our speakers, Mayor Andrew J. Ginther, Commissioner Erica Crawley, Christine Sander, Maureen Stapleton, and of course our host, Tracy Townsend. Thank you. Thank you all for joining us. We could not do this without you. We look forward to seeing you next Wednesday as the Columbus Metropolitan Club presents another community conversation and celebrates our annual meeting. Thank you. Have a great day.